burden on our health systems. This journey, Excellencies, is also about redoubling our trust in healthcare. It's about shifting our approach from ad hoc funding support to recognizing the need for investment in human capital. It is about co-creating solutions with our communities rather than merely providing them. And evidence has shown that investing in primary health care yields a tenfold return in investment at scale. To our community health promoters, I extend my heartfelt gratitude. Your dedication and commitment are nothing short of inspirational. And as a primary caregiver in your community, you bear the responsibility and privilege of upholding the mandate of primary health care in Kenya. I have had the privilege of interacting with some of you, and I can attest to the passion and the dedication you exude. The comprehensive range of services that we saw the Honorable President interacting with the family offers an opportunity for integrated programming, integrated financing, and integrated systems thinking, which will undoubtedly yield results for our children, adolescents, and marginalized population. Your Excellency, as development partners, our collaboration and partnership with the Government of Kenya and the civil society and academia are greatly facilitated by your clear strategic vision, unwavering leadership. Countries worldwide are now looking to Kenya as a beacon of hope and a source of inspiration on the path to universal health coverage. As UNICEF and as United Nations agency, WHO and UNITS in the room, we remain committed to supporting the establishment and expansion of primary care network, aligning this with the priorities of the Kenya government. Our focus will be on optimizing innovative approaches, leveraging the new technology platforms, evidence-based planning, and progress measurement to enhance the delivery, implementation, and impact of these initiatives at scale. As UNICEF, we take immense pride in collaborating closely with the Government of Kenya to support this remarkable journey. Once again, in closing, congratulations on achieving these remarkable milestones, and a huge thank you and best wishes to all of you and Ministry of Health to see us that we are realizing the achievement of the universal health coverage and primary health care. Thank you.
Asante sana, wacha niite Lauren Moore kutoka kampuni yangu inaitwa Johnson & Johnson Foundation Vice President. Ms. Lauren Moore, who's the Vice President, Global Community of Johnson & Johnson Foundation. Welcome. I said it's my company because I'm also called Johnson, so I need some shares.
Thank you. Thank you. As they shared in the introduction, my name is Lauren Moore, and I'm here on behalf of Johnson & Johnson. It's an honor to be here with Your Excellency, Dr. William Ruto, President of Kenya, the Ministry of Health, the Honorable Cabinet Secretaries, Excellencies Governors, community health assistants and promoters, and many of our esteemed partners and visionaries. And most of all of you community health promoters who are here today. President Ruto, thank you for the invitation to join you today to recognize the critical work of CHPs in Kenya and to thank the Ministry of Health for your partnership with Johnson & Johnson over many, many years. I was able to attend some of the United Nations General Assembly meetings in New York last week, and I had the privilege of listening to many community health workers from around the world who couldn't be more different from each other, but also were fighting for the same things: to be heard, to be valued, to be treated with dignity, to be provided safe working conditions and fair pay. When we bring health workers to the table to discuss solutions like the Kenyan government has done, that's when we begin to see progress. One of the things I learned last week, and I just heard on the stage today, nothing about us without us, which is about you first and foremost. We are here today because the Kenyan government recognizes that good health starts in homes and local communities. The government recognizes that supporting community health workers is the only way to ensure that all Kenyans have access to quality primary health care. Although community health workers are so valuable to keeping communities healthy, until now, most did not receive stipends for their services. This has led to high rates of turnover and burnout among community health workers as they struggle to balance their volunteer work with income-generating activities. And we know that the majority of healthcare workers are women, which places a disproportionate burden on women, especially those with caregiving responsibilities. Kenya's success story is an inspiration to other countries seeking to strengthen their community health system and improve community health outcomes for their populations. This is a milestone and a victory for CHPs in Kenya and for community health workers all over the world. This example, people are paying attention to this example, and we're incredibly proud to be part of this progress. CHPs, you hold the health of your communities, in fact, the global society, in your hands. At Johnson & Johnson, we are inspired by you, and we recognize and applaud your vital contributions to your communities. Thank you, and thank you, Your Excellency.
Asante sana, tunaomba mtuwe radhi, najua jua imewaka kabisa. Lakini hii safari tumevumilia miaka mingi, leo ni siku yetu, si ndio hiyo? I know Lea Kibe will be very brief.